seen me the last time around. It's been a while. This little packet is something for you to keep, and if you want to make more copies, you can make more copies. But you actually even get a little bonus in the back, because I didn't know this was back there. These are examples of CPAP and BiPAP orders. So it'll kind of help you out if you get, they said it's a CPAP and it says 12/5. Well, you look on that little thing and that's not a CPAP, that's a BiPAP. So that might help you down the way. So you, like I said, you kind of get a little bonus. Keep going. One more pack. Back, no, the other way. There you go. So that might help you, you know, sometime down the way. So I just thought, I was going to take it out and I thought, no, I'll just leave it for everybody. So we'll have to make some more here down the way, okay? So, sounds like you're going to be getting a trach here soon. We don't know exactly what size trach he is or what percentage of oxygen he's on. But this little packet right on the front, if you get a trach inquiry, then you can find out what, if they got a Shiley trach, if it's cuffed, uncuffed, disposable intercannula, and you can put what size it is. The same way with the Shiley XLT. These are the XLT, they're extended length. This one is proximal because the bend on the trach is back farther. So somebody with a short, thick neck may have this kind of a trach so it stays in all the time compared to this little bit. Because then the chances of it sliding out is really great. So half the time it's halfway out. So that's why they go this route. So I just wanted to make you aware of those. If they do say it's an extended length trach, you need to find out if the bend's proximal or distal. So it's on the little paper, distal, proximal. And then they have the Portex trach and we have Bavonis. A lot, 3/4 of them use the Shiley, so we don't have to really worry about that. Shiley are new. Well, they're not new, they've been since the COVID, but they're a lot more pliable. They've got a disposable intercannula you just squeeze and put a new one in, and it snaps right in place.
Were they always disposable? Because I don't remember.
No, they have reusable
Okay.
and they had disposable, but the disposable one had the little tabs that you had to get them in just right, or else they were half out. And time you got both tabs in, then they'd be coughing, and then you'd have a mess in your hands. So this is so much nicer. Is this? So if you guys want to look, sorry, I didn't mean to just throw it at
If
you.
they're not disposable, how do you get them out? You said they click in, so how do you get them out? Did they just, you squeeze it too?
Yeah, you
Same
just
way?
squeeze it. Yeah,
I
squeeze
never
it.
dealt with one, so.
Well, I'll let you check her out, okay?
Yeah, you can feel that pop in.
Yeah, it's a lot nicer. Yeah, I went before I got here to change a trach, and the lady, she goes, "They changed that thing this morning." I said, "No, honey, we're changing the whole thing." She's like, "Oh."
Okay, tell me what this is for.
That is if somebody has a cuffed trach.
Okay.
Say somebody that aspirates, somebody that's been on a ventilator, then they will have that and it'll be inflated.
Okay.
The 3/4 of them, when they get here, you don't have to worry about that.
Okay.
Okay? That you just want it to be flat. You don't want that balloon to be inflated. Especially if we use a talking valve with it. Because what that talking valve does, when they inhale through that trach. When they exhale, there's a diaphragm that closes off and that air's forced up around the trach. So say I had that balloon inflated, they could inhale, but they couldn't exhale, and they would go in respiratory distress right away. So that's why, if we can get them away from that cuff trach, we don't take them unless they're cuffless, okay? So, this little fella here, he's got his trach. We need to find out what percentage of oxygen he's on. Now, they may say he's on 21%, so everybody gets freaked out because the EMTs bring him on 15 liters and they said it's 21%. Well, 21% is room air. So we would use this for humidification, but we would not incorporate O2. They would just be getting humidity, okay? So, kind of like jumping around. This is my little graph for my airboat. So across the top is my airflow of my machine. Down the side is my oxygen liter flow, okay? So it works the same principle as your venti mask, okay? Your venti mask, you have your room air, it entrains with that oxygen and gives the percentage, okay? That's what this does too, okay? So I always set the flow of the machine on 20. So I would go across the top and find the 20. So say they're on 28%. Now they may call from the hospital and say they're on 6 liters, 28%, and then you get in a panic mode because we don't have a 6 liter concentrate. And I say, no, you don't have to worry about it, it's only 2 liters. So when you find that 20, go down to the 0.28 and then come over on this side and it would be 2 liters. So, see what I'm talking about? So if somebody has a lot of secretions and we want to thin them down more, we can increase that airflow. Let's say we go to 30. We're going to go to 30. We're going to come down and find something that's close to 28%. Well, there is a 28%, but when we come over, it would be 3 liters. But we're still achieving that 28%. So if state would ever ask, that's what we're achieving is the 28%. Okay. So this would be what my order that you would put in there. Airvo at 20 liters of flow with 2 liters of oxygen equals FiO2 at 28%. Now I tried to zip tie that and put it in a plastic sleeve, so then you have it up there too, so you know all about that. The supplies on this gets changed every other month and I come and change it. So that's something that you guys don't have to worry about doing a weekly change out and all that kind of stuff. I do leave, yes
It
ma'am.
sounds stupid, but like this right here, what is it that would get a leak? Has that ever happened?
A long time ago it did, they had faulty ones
Okay.
and we just had to send another bag.
Okay, so what do I do? I work at night, so what happens if I start seeing it leak or something?
Then, if you can't fix it, shut it off and put them on a venti mask till the next morning.
I've never dealt with a mini map.
Okay,
Or,
so this little venti mask runs on 3 liters or 6 liters.
mini maps.
And I'll leave one. So at the 3 liters, it has 24, 28, and 31. So I would dial it in, say at 28. But I'd have to run my oxygen on 3 liters. Because remember I said room air, oxygen, entrains, and gives a percentage. On this type of venti mask, I have to use 3 liters and then dial in that 28%.
Okay, and then this hooks up to what?
To a
That sounds
trach.
stupid.
No.
Okay, I'm not done with all that.
This will go to the trach mask,
Okay.
okay? And then call us and let us know. I will leave a trach folder too, so it kind of goes through everything, and if you have any trouble or anything like that, that you can call us and you know, we can solve the issue. So that would be for portability. Now, if they were up on, say, 40%, I would have to put it up on 6 liters. See, it's got this little group here, that's 35, 40, and 50. And then this group down here does the 3 liters. But I'll pass it around so you can see it. But all you guys have to do is pull it out and move that little arrow.
Okay.
There you go. I do leave an extra one of these because sometimes patients will pull and tug on it. So it's normally in a little plastic container thing that all you have to do is just hook it up. This just snaps right in place, and then it would go right to the trach mask. Okay.
How can I not turn it off?
For humidity, all we need is gallon jugs of distilled water. That's the only kind of water we use for the air boat. This opens up here, and you fill it, and your fill line's right there. Okay? If by chance the water would run dry on it, it will beep, and it will keep beeping until somebody comes in and puts water in. So the chances of him getting a mucus plug is very, very slim. Okay? On the screen it will say add water. So you'll just put water in there, and it does a gravity drip, so that will not be full. It just, you can see the water dripping down in there, and then it'll do a little happy note, and everything's good to go. Okay? My O2, like I said, my O2 is bled in here, and then for that 28%, that would go to my concentrator. Okay? After I do my little graft. I think that's it. I normally leave on the other side of the plastic sleeve how to operate it and highlight it in case anybody has any questions. You know, then you can look at that rather than get in a panic mode and have to call, you know, whoever to have questions. When he comes, I'll go through stuff some more. So, you know, if you want to work something out that way, we can do that. But that's basically it on that. If it would be running, that's how quiet it is compared to an air compressor. So, you don't have to worry about it making a lot of noise. Normally the concentrators make more noise than that does. So, you don't have to worry about that. Does anybody have any questions about this?
If the machine would start not malfunctioning, what sound would it make, or would it let us know if it malfunctions?
It would beep, yeah, and it would say like a leak, but you'd look on the screen. Actually, you can get on your app store and type in My Airvo 2, and you can download the top of the machine. Then you can sit and kind of mess with it, or troubleshoot. If you have any questions, you can do that. That kind of helps people out too, that they don't freak out so much. Okay, so for suction, this is something I like to bring too, especially with being the first time having a trach, is the bedside pulse oximeter. So this will alarm if his sats drop below 90. So then I know to go down to the room to see if maybe he has his trach mask off, maybe he has his trach out. Then you can go solve this situation from there. But there is a disposable finger probe, or we can do an ear probe. So that's kind of nice. This is normally a daily charge, so after a few days you see they're doing fine, then I would say, hey, come pick it up. You know, I don't need it. But it just reassures everybody, because a lot of times, excuse me, your trach patient is at the end of the hall and the nurse's station's up here. So a lot of people kind of freak out, especially, you know, evenings, nights, when there's not as many people running around. That way it kind of reassures everybody that things are okay. Okay. You want to make sure that you have the same size trach at bedside and a size smaller. You want to make sure you have this obturator and a package of lube gel at the head of the bed. And the reasoning for that is, say I walk in the room and he had pulled his trach out. Well, I don't know how long it's been. I'm not worrying about doing sterile technique or anything like that. I would grab some regular gloves, pull this inner cannula out. Open this up, get my obturator, and slide it in. So see that obturator? This just helps guide in the trach, and it keeps, if they're coughing, they're not gonna cough on you right away. So then you would hyperextend his neck, and I put some lube gel on it, and then you would slide it in, and then get that obturator out. Okay. Then go ahead and put his trach collar back on, and I would get him a new inner cannula. So then I would open a new one up. Well, come on. So then I would open this up and get the new one out, and then turn it to the side, and then it slides right in and snaps in place. Okay. Then I would also let the doctor know that it came out, and we didn't do sterile technique. We didn't put in a brand new trach. We put in the one that was out. So then if they want to put them on an antibiotic or something like that, they can do that. Okay. So, any questions on that? Trach collar, you want to be able that you can get 2 fingers, because the looser you get it, the more tendency of that trach popping out. And some of them are pretty grumpy. They like to have it pretty loose, and I'm like, no, we have to do it like this, because I'm not coming in and having to put in your trach all the time. So, and I like this kind of trach collars because it'll fit any size neck, and then I can cut the excess. So, suctioning. Normally a size 8 trach, I use a 14 French. A size 6 trach, I would go down to a 12. And a size 4 trach, I would go down to a 10 French. You want to be able that they can get some air when you're going into suction. They always say pre-oxygenate. You don't have to give them 100%. So, you know, put the trach mask up there. Open up your trach care kit. I'm not putting gloves on today because put my water in there. Turn on my suction machine, and always make sure my suction machine's working before I'm gonna go down and suction. Then try to keep this as a sterile hand, and this would go to my tubing for my suction machine, okay? Then I still check and make sure it's working. So like I said, I gave him oxygen. I'm gonna go in till I meet resistance or he starts coughing, and then I'm gonna do intermittent suction as you come out. I wouldn't be down there any longer than maybe 10 to 15 seconds. Then put the trach mask back up there, let him catch his breath. If he's still rattling, then I would go back in again, intermittent suction, and clean out my tubing. I wouldn't do it any more than 3 times. Sometimes the more you suction, the more they bubble. So I always say, you calm down and I'll come back in a few minutes if we need to, then I'll, suction you some more. Then always clean out your tubing and throw this away. Don't ever have that sitting in a bag like that hooked to my suction tubing that I'm gonna reuse, because we don't know what is growing in there. And these are a lot cheaper than you have to put all that stuff on. So, always kind of make sure if you're getting close to being out of disposable inner cannulas, suction catheters, that you let somebody know. So, if you guys can't get them ordered, that you can call our office and we can get them overnighted, that you'll get them the next day. Because if not, then you're gonna have to clean that inner cannula, and it's a lot nicer disposable. So, always look out for the person that's gonna be coming and taking your place, that they have stuff to be able to do their thing. All right, so then my trach care kit, I'm gonna open it up. I'm gonna have regular gloves on, and I'm gonna open it up and open this the best I can. I think it fell apart. That's how many times I've used it. Open it up, and I'm gonna dump this on my sterile field. Then I'm gonna go ahead and open up my inner cannula. And don't do that. Put it on your sterile field, okay? Then get the drain sponge with your non-sterile gloves and get rid of that inner cannula. So then I would, where's my lost my water. There's my water. So it's over here too. So then I would put on my gloves. They're all tangled up. And then I would put some water in the hole. And then if you had some peroxide, put a little bit of peroxide and then some water there. And then I always put, everything's sticking. 2 for peroxide and water. And they're supposed to be 2 for water. My hands are rough. So, then I would take a peroxide and water and go from one side all the way across. Then you take a water and go one side all the way across. Now, if you don't have peroxide, you can do the sterile water that way. Across, and then down at the bottom, all the way across. So then, if that plate's clean, not gunky, go ahead and grab your inner cannula and slide it in and snap it in place. Then you can put your drain sponge underneath there and you're good to go. If you are changing the trach mask or trach collar, I'd say have 2 people to start out with. And then if you feel a little bit more confident, then you can do it yourself. Or if he's pretty with it, have him hold it while you string it through and do it that way. And FYI, he's taking care of it at home, so kind of watch out. He may be one that the inner cannula may be on the table. He may take it out and put it in a glass of water. You know, just kind of watch him and then, you know, kind of reinsert that. This is not a sterile technique. We are in the nursing home right now, so we really need to do the sterile process. Now, sometimes that works and sometimes it don't. But this thing here is, say he doesn't wear a talking valve or anything like that, and you want to get him a shower. This goes right on there, this little nipple thing, and put it to my O2 on my portable. That traps that warm, moist air.
What's that called?
An HME. And it stands for a heat moisture exchanger. So then if he gets coughing and he needs to suction, there is a little port there.
Zoom, zoom, zoom.
And that's only for showers.
Yeah, sometimes, you know, if they're on room air and stuff and say he doesn't wear it all the time, sometimes I'll put that on him, you know, just to keep that warm air. So I don't have to put a trach mask on him. You know, sometimes, especially if they're getting kind of gunky and stuff, sometimes I like that, then I don't have to worry so much about it. I'm sorry, so I bounce it across the room.
Now, that sounds stupid, but is that reusable?
If they get a bunch of sputum in it, then I would throw it away.
Okay, so
and
when it
get a
looks
new one.
yucky,
Yeah.
you can tell.
Yeah. But I would just put it back in a, you know, if they didn't cough or anything on it, I would put it back in a Ziploc bag and, you know, you'd be good to go. So there again, like I said, this is the talking valve and it has a little attachment that you can attach it to the trach collar. So if they cough, have a forceful cough, it's just gonna fall right there rather than pop across the room. This one is a low profile, so it doesn't stick out as much. They have a turquoise one, but it's kind of like, it's been in line with the vent, so it sticks out a lot more. So they have a clear and purple, that's more low profile. This needs to be off when they're sleeping, because they may cough and get secretions build up in there and then not be able to breathe. And then when they're getting a breathing treatment, because that medication from the breathing treatment might mess up that diaphragm. cleaning it, just sudsy water, rinse it, and then put it back in the little plastic container.